Hey everyone, I wasn't sure I was going to have enough voice left to do this stream. Been wanting to do it a little while. I've already done 2 live streams tonight, so wow. We'll see how long this lasts. Which brings up one of my other points. Well, actually, it feeds right into my whole topic. Drug treatments and side effects of cystic fibrosis Jenga. Um, yeah. Drug and treatment side effects and cystic fibrosis Jenga. There, see? Can't even get it right. Need more air to get it right. um, well, as you can tell, my voice is going away. You could say it's because I've done 2 live streams tonight, totaling about 2 3/4 hours. So 2 hours 45 minutes with a breathing of live streams. You could say maybe that's your problem, possibly, but actually no, because it starts getting bad pretty quick if I talk too much. This here is a side effect of the treatments. The forced coughing all the time for decades gets to your voice box. My voice doesn't even sound like it used to. I have a horrible sounding voice, and I've heard tons of other CF guys' voices, and we sound a lot alike. It's because of all the coughing and the infections and stuff in your throats and breathing treatments. And even the women, you have different sounding voices, a little more than us guys, but even your voices have a combined little sound you can hear. But yeah, see, so my voice, I actually sang in choir through my grade school years, even up into high school. I was in show choir. I was a very smooth, gorgeous baritone, and you couldn't tell it now. Now I've got a, well, voice for silent cinema. Too bad my face is good for radio, so every once in a while when I don't have my voice all burned out like this, I can physically work my voice and push it back to where it was and actually still sing for about a minute. But I can't hold it anymore. This isn't due to all the coughing. You force cough, or even when you don't force, when your lungs are making you hack and cough, you cough so hard, you have veins popping out of your veins. And that is horrible. It tear up and heal on your voice box. Sooner or later, you start losing. I used to be able to do sound effects and tons of imitations and voices, and 95% of those are gone too. My control of my voice tone is almost nothing. And as side effects go, this is annoying. There are times when I'm on certain medications, Kasten, Toby, you do it too. I can totally lose my voice. Which, considering how much I do YouTube now, you need your voice is a very bad thing. So I'm gonna have to try to moderate a little bit, especially since I'm doing 3 YouTube channels. And one of them urban exploring, and I do live stream on there. I do a political news, just whatever's annoying me rant channel, and then here. But yeah, this is one of the most minor but very annoying of the side effects of cystic fibrosis treatments and the therapies. Um, Another one is my back. And I know a lot of CFers have this. The therapies, your abs, I mean, just, forced coughing tears up your lower back. Sometimes just the rampant, terrible, spasmodic cough we get tears up your back. Pushing yourself, just sitting up doing the treatments, so much just tears our backs up. I don't know barely any CF person over the age of 20 that does not have horrible mid-back problems off and on. And I've got them. Now, what I don't know is how many of you have the same problem I do. Mine was partially caused by a car accident, but I had it a little before, but a lot worse after. When my mid-back tightens up, it connects right around as a band to my diaphragm and some other stomach muscles. When my back's tight and hurting, it makes it so I can't breathe at all, even compared to when I normally can't breathe. I will go from I'll go from, if this is the same treadmill workout, or trying to do the exact same treadmill workout. One day, I'll be running a heart rate maximum of, let's say, 120, 125. And I'm pushing pretty hard, but I exercise my whole life, so I got a low rate. And my O2 level will be between 90 and 93%. No, pretty good for one of us. I'm huffing, I'm puffing, but I'm there. Next day or so, enough. I'll be trying to do the same thing. But my back is tight, my diaphragm clamps down, and I stop because I'll get down to about 86 to 87%, and my heart rate's 140. I just can't get everything to work. That is in direct relation to the damage from all the coughing, the therapies, the treatments. It just tears us up. A lot of people, they realize the lung part, the digestive part, they don't realize as much a lot of times, but a little more than the rest. These side effects really get to us. The improper absorption of vitamins and minerals. This little side effect. Bones and joint issues. You can get arthritis, but some of the drugs help amp that up. I can no longer take ciprofloxacin. God help me if I said that wrong. Everybody just calls it Cipro. Cipro was one of the best drugs to keep me out of the hospital. But I did always have a little bit of an issue after some years on it, off and on. About 10, 12 years ago, I started getting certain tendons would get sore when I was taking it. It would usually pick one tendon, strangely. A hamstring that oh boy, you ain't doing hamstring curls for while you're on the Cipro. Or it would be a bicep, or it would pick one tendon. It was strange. Over the last 3 or 4 years, it's suddenly jumped way up. If I was on Cipro, now that I get the fun digestive effects of it, I would have all my joints hurting. Every tendon was a little touchy. Or actually, it was pick one tendon that wasn't. It got to be slower recover after each time I used it. Last year, I had to use it before I went in the hospital. I went in the hospital, they gave me a bunch of Cipro in there. They were throwing everything at me to stop me from crashing any lower than 20-something percent. It was right around 20, 21% when they finally got it to stop. But ever since then, I cannot take Cipro. I even talked to some of the doctors up there and told them it's taken me 9 months now, 10 months, to get back to where I can lift weights at a decent level, where I can do treadmill without being in abject pain the next morning before I go do treadmill again, because tendons and joints hurt. They're still not the same. And they may never be the same now, and that is Cipro. And some of the other IV drugs they give us and everything beat us up too. But Cipro's a bad, bad boy. Whew. Even now, I just got things that hurt, and boy, I wish I could blame it on my age. I wish I could blame it all on CF, but no. If you read about Cipro and you read side effects, people rupture tendons on that stuff, tear tendons, blow out cartilage. Oh my Lord. Then if you've already got the CF back problem, yeah, amps that right up and helps make that cartilage and everything hurt even worse too, and the discs. Lovely. So I got that, and that don't heal. And I know a lot of us CFers run into that. You get drugs that beat you up. Too many IVs beat your veins up. Gets to the point where even CFers that prefer PICC lines, because when I leave, I have nothing. I don't have anything maintenance that I can bump, that can clog up, need replaced. Nothing weird. I get to leave. But lifting weights and exercising has helped keep my veins good. But sooner or later, someday, what if I can't and I have to have a PICC? Because once again, the drugs and all the PICC lines tear up your body. Then there's another neat little effect. Some of the drugs before you ever get a transplant or get considered, while you're just on CF, amp up your sugar levels and can actually make your pancreas part worse. So the digestive part, some of the drugs to help your lungs edge you even more towards the diabetic part. It's like, lovely, we need that help. Great. Now I'm not only CF, but I'm CFRD, CF-related diabetes. Lovely. Thank you. But from what I hear, pretty much 98% of everybody that gets the lung transplant, you are diabetic. Oh, that's helpful as crap. So, I mean, it's just one effect after another. Some of the drugs affect our hearing. I have a friend of mine, Mark. He has horrible ringing in his ears. I thankfully don't have tinnitus. In fact, I can out-hear my wife and out-see her so far. I did LASIK about 11 years ago. They did send me a letter about a year ago saying, hey, your close vision might be getting a little funky. We may have to do a touch-up soon. And they are right. From here, actually right here, I'm perfectly focused. And here out, I'm perfectly focused. But if I try to go in any closer, like here, I cannot focus at all. So yeah, this next coming year, I'm probably going to need to touch up my LASIK. But some of that is due to some of the drugs also, and the high pressure from the coughing of the treatments. Then we can get into things like the vest, which I don't use. There's a reason that the vest is not the best known treatment for CF out there. And in a lot of countries, they don't even use the damned thing. It's not even recommended. That's why CF care centers, accredited ones, what do they do when you're in the hospital? They ask, yeah, sure, do you have a vest? If you don't want to use it, can you use it? Or do you want to use one? But what do they use for the hospital when you're in there most of the time? Chest PT, the manual PT. Why? Because it works the best. But it does beat you up and make you sore. But for me, the problem is, and I run into a lot of other CFers this way, the vest, if you cough up blood, it makes you cough up a lot more blood. I have not used my vest in months. Usually when I use my vest, I can use it 1 to 3 days, maybe 4 if I'm lucky, even on a low setting. And if I haven't been coughing up blood in a long time, oh, I will be. And it lasts for a long time. That thing, no matter how I adjust it, set it, use it, it makes me cough up blood. I used to think it was just me. I found plenty of other CF people who say, won't touch that damned thing. Makes me bleed. So I'm sorry, but chest PT, the manual PT, is known for a fact to still work the best and doesn't cause the bleeding issues in a lot of us. The other one is the percussor. A lot of people like that little air-powered or very, very, very weak electric percussor that, I'm sorry, I couldn't massage my toes with this thing. Problem is the percussor I use, and a couple other people I've gotten to use it, and they love it, is the ElectroFlow 5000. It's electric, and this thing will hit. It is also noisy enough that it'll wake people 4 blocks away. In fact, I'm betting when I use it, I'm betting my friends in New Zealand can hear this thing. They're probably wondering, what is that weird noise? The good part, I can use it a lot without it causing me to bleed. Even when my PT is causing me to bleed, it doesn't, even as hard as it is. It also is very adjustable. It has a strap. You can use it on your back yourself, everything else. Great. But sometimes when I got stubborn crap, I'll crank that thing up. The next day, when I go try to use it again, ow, every bit of your ribs hurts. How many CFers haven't had days like that, especially if you're in the hospital? They're coming in doing your PT. They want you to use your vest. They got a guy coming in doing percussor on you. Then the next day or two, I swear to God, if you sneeze, you're laying on the ground crying. You're just so beat up. Good old treatments. You gotta wonder how much that pounding and vibrating, how much of a toll does that take on our internal organs, on our bones? I mean, woof. It's gotta amp it up. I mean, just getting holes poked in you from the IVs. Then the fun thing is when you're in the hospital, and well, I think most CFers get this one. They give you an IV medication that you're allergic to, and they know you're allergic to it because 90+% of CF patients and humans on the planet are allergic to this medication. But they give it to you because the bugs in our lungs are much more allergic. In fact, they are deathly allergic to it. So what do? They give you then? They give you Benadryl. So here's a couple Benadryls, and then they're coming in trying to do treatments, or they want you to go down and do physical therapy or something, and you're just trying to stay conscious. Benadryl makes you faceplant. There's been times in the hospital where I got plenty of sleep. I did a workout. I was feeling good. I had a shower. I'm up. I'm going. Even had a little caffeine in me. They'll go and give me the meropenem or something else where I need that Benadryl. Give me the Benadryl, and I swear to God, 35 minutes later, I'm face down on the bed. That stuff is horrendous. So there's a great side effect. You're trying to stay awake. Then if you got a treatment schedule, you get off it because you're passed out. Man, so you wonder. Side effects. How about side effects from something simple like, okay, CF. What do we have a problem with? Our lungs work like crap. We don't get enough air. So in all the CF care centers, and I understand why we do it, what do they want you to wear? A mask. And the ones they have us wear in the hospital don't cut your oxygen down much, but it don't take much sometimes. The ones I use in urban exploring, I think they filter out about 40% of the oxygen goes through. Actually, the doctors I was sitting told me that, yeah, they aren't fine with me doing the urban exploring as long as I wear these masks. And they admitted, yeah, they do filter out a lot of air because the surgeons that usually use them aren't huffing and puffing and exercising. They're just standing in one spot. And these things are made to filter out everything so they can do surgery, open brain, open heart surgery on people. So you can imagine how much fun it is for somebody with his lungs in his 30s percentages huffing around in a damn mask like that once in a while. Oof. But the rest of us, we all know how it feels. You're walking around the hospital in a mask. Boy, you take that mask down, you're not doing too bad. You put the mask up, and holy crap. Don't take much to take effect. Just side effects. And it's all in this, and I call it Jenga because the bad thing is if you pull out one of these little treatments, the lungs collapse. Pull out one of these little treatments, your digestive system operation collapses. Pull out one of them, if you got CF diabetes, poof, there goes your blood sugar levels. Oh my God. it's all stacked in. The illness, the medications, the treatments. It is a big game of Jenga. And people think it's just about the lungs. It isn't. And honestly, yeah, sure, the lungs are what usually kills us, gets us, messes with us, puts us in the hospital more often, but the amount of digestive effects, bone effects, even sexual. And I have no problem talking about this. Once again, I'm happy to be alive. But some of the medications, male and female, dampen your sex drive at times, or can make even, and I've talked to I have some very honest male and female CF friends of multiple ages. Even my female CF friends say that once in a while they're on certain medications, their girl is not doing the job. They will be in the mood and they'll Pikachu down there saying, ain't happening. And for the guys, oh, I know for a fact, at least a couple of antibiotics are anti-Mr. Happy doing his job. That's some annoying shit, let me tell you. And then let alone the fact that as your lungs get worse, it's harder to breathe. So if you're trying to have really good sex, you can get out of breath, and that is a damper on whether you have, especially if you're a guy. Sorry, ladies. We men do 90% of the work in sex. Most of the time, you guys get to enjoy the ride. It's a little easier if you're not breathing. But when we're not breathing, that gets rough. Thankfully, there's ways to get around that, or you just wait for when you're off that medication. So not only do I get to be 45 years old and I have normal friends at 45 that have sexual problems. And a few of them are female that have, well, they've lost their sex drive. It seems like a lot of women over a certain age, it seems like in their 30s, women have a hell of a sex drive jump up. But some of them can lose it in their 40s. Must be kind of scary. But none of my friends have male friends have lost it. But sometimes in their 40s, some of my male friends, the shit isn't like when you're 17. It doesn't just spring up when you think of having bacon for breakfast. So you add low oxygen level, high stress, a bunch of weird medications flowing through your system. Oh boy, there's a side effect that 90% of the guys won't talk about, and even as far as I can tell, from some of the female friends with CF I know, about 70% of the women won't talk about. Well, if they'll even admit it, is something they have a problem with. A friend of mine, she says that most women do have problems with it, but they won't admit it. The guys are slightly more admitted. How can you tell? They just get angry. I'd rather look for solutions and get angry about it. Since my wife is gorgeous, I'll do anything possible to, well, God forbid she ever sees this, but I'll do anything possible to hit that. If there's a pill I gotta take, or wait to assume I'm off my antibiotic, whatever it takes. But now there's another side effect. Back in another block in the Jenga stack. And the older you get, the stress of all the meds, the therapies, the stress the illness puts on your body, it is a stack. And honestly, there are people, I have CF on what I've been told in the past by doctors is about a level 7 to 7.5 out of 10. Maybe an 8, doctors say. But there are people that have it a level 1 where pretty much they didn't even know they had CF until their mid-upper 30s because they had no effects at all, nothing. Or very little, so little you couldn't even, it was so hard to even pick up on as CF. So that is about where I'm at. I'm about a level 7, 7.5, maybe an 8. That's what they told me when they had to quantify it one time back in the day. Just move on quantifying where everybody was. They tried to use a number system for years. That was fun. But, and honestly, I don't have it the worst. I had CF friends that never made it old enough to the age to get into a rhythm of exercise, of therapies, of self-sufficiency. They had it so bad when we were 12, they couldn't even develop that. There were few like me that did. Of the big group I knew at age 12, I am the only one left alive. There's another one who took working out as seriously as I did. He had CF at probably a level 8.5, maybe almost 9. He did die about 15 years ago, but he lived way, way, way longer and better than they ever said he would, because he was like me in the gym. We used to text each other where he was in his hometown and me when we were at the gym. We'd push each other. We helped each other stay alive longer. Mike lived a lot longer. He was a fun kid. I've known plenty that haven't, though. So it is such a weird Jenga. And that's another thing. If you are a CFer who exercises hard, and that exercise, I can't stress to any of you out there, exercise is one of the best things to slow this idiotic crap down and make your CF squeal. But CF becomes another Jenga block and more time. I do know when I do take, actually, I started as of this year taking 1 day off a week of my exercise at the gym. I am not a spring chicken. And also, it's nice to spend a day with my wife, considering I have to do all these hours of therapies anyway, still during the day. But if I pull that Jenga block out, I can get maybe that 1 day off without having too much of a problem. But if I take more than a day or two off in the week of my exercises, my lungs show a horrible effect. It's another block on the stack. For any of you out there who do exercise incessantly, lift weights, which makes our bones better, even for us CFers. Make those bones more dense, less issues. If you lift weights, do the cardio regular. You know what I mean. If you miss it, not only do you feel mentally bad because you missed that endorphin rush and you've got a habit built up, but you're physically, your CF will bite you in the ass that quick. So a lot of times you don't quit. Sometimes we work ourselves and cause more of the other pains, more of the joint and muscle and tendon pain, because we got to push hard. You can't take days off too much. There are some that don't work out, and I am flummoxed on how you don't. Next to, it is one of the best things there is to do and to keep your CF at bay. And you are your own best piece of therapy equipment again. Manual PT, you can do yourself. You can be your best piece of therapy equipment. Exercise, you can do yourself. You got to push those lungs. Dude behind the camera, are you going to go to the hospital for exploring this year? I don't know. My insurance is a little twitchy about me going in. They kind of like to have to make them call it an emergency admit. If I start coughing up blood in the next couple weeks, which happens to me off and on anyway, but my doctors can use that to say emergency admit and get me in. I might do it. It's been a long time since I've been in. I've been doing pretty good holding steady, but it has been up and down lately. It's taken a lot of work here lately. Unfortunately, that's why they put me on disability, and they were right to do so. And even my exploring does give me, that's why I was surprised they were happy, but they said, no, is the exploring, they know me. The exploring will keep me busy. I have to be busy or I lose it. I have to be up and moving as much as I can. And the exploring, and they said, no, that's exercise. It's good mental workout for you. It's something you enjoy. And if you'll wear the masks and do it on your own schedule, yes, you can do that. We have no problem. And I can. Even when I take long car trips, I stop on the way and do my breathing treatments and chest therapy in the car. I have an inverter. I run my nebulizer, all of it. I go to hotels that have gyms or are really close to an Anytime Fitness where I can use my membership. I do everything. So that's worked. But another block in the Jenga. So for curiosity, in case any other CFers see this, leave any comment below. What block in the Jenga is the biggest problem for you? Is it the treatments, the medications, exercise? And then for side effects, what's your worst one? Besides the lungs. We all know the lungs are horrible freaking things. Is it joint pains, back, which includes back pains? Um, what is the biggest side effect for you of the CF and or the medications and treatments? But let me know. Dude behind the camera, how do you pick the right motels? I use online hotel reservation sites. My wife is partial to hotels.com, and she has a membership there and we get points. And if I can, I stay at a Best Western because I also get Best Western points, which is a very good rewards program, by the way. And Best Westerns, on average, seem like pretty good, clean hotels. And they usually have pretty good breakfast to go along with them. And if they don't have a great gym, they usually have pretty decent treadmill or two and one or two decent ellipticals. So at the very least, I can do straight cardio. Yes, dude. That's the only reason I use the online hotel sites. I am extremely worried on the hotels. I won't buy. That's where I have to spend a little more money. Some people I know will stay in a super cheapy hotel, even if it's kind of dirty. I won't. I have to stay in a decent hotel. That's why I try to stay in one of the national chains. Because the national chains, to be involved in them, you usually have to keep a certain standard. And then also, I read a lot of customer reviews. Not reviews from anything else. I read the ones from people who've stayed at that hotel. Hotels.com and a lot of these others are very good at customers' reviews. There was a hotel I was going to stay at in Richmond, Indiana with Sean here recently. But we started reading the reviews. The price looked great. The amenities looked good. Started reading reviews. Some of the rooms smelled like cigarettes. They actually allowed smoking in parts of the hotel, or too close out front. It was getting into the rooms. Some of the rooms had a weird musty mold smell. Oh, I can't do that. Some people were finding dirty sheets. So yeah, we read. Well, now it's me and my wife. Sean's not involved. I read customer reviews. So yes, I look for clean hotel rooms. I even brought a black light from my toolbox and my dye light glasses for my air conditioning work with me a couple times. And I busted one hotel out and got a free stay because I pulled back the comforter, took my black light and my dye light glasses. It doesn't work as well as luminol or something. But if you turn the lights off and it's dead dark in that room, you take that dye light for air conditioning work or your dye glasses, you can kind of see if there's some funky stuff on the bed sheets. And I busted a place out and I got a free 3-day stay. But that was not a Best Western, by the way. It's one of the last times I stayed in a non-chain. But yeah, I am very worried about contamination, illness, dirty. So I do have to pay attention to that. So people would think it's weird that I do urban exploring, but actually they are less worried about what I'll pick up urban exploring, especially if I'm wearing the masks when it's bad, than they are people. People are a bigger danger. I'm not supposed to be around groups of people. My last job, I had people walking in, coming up to the counter, talking to me. Even when I was just a straight mechanic, I was getting ill because I get into a customer's car who like wiped their hand with their, the nose of their hand and touch steering wheel. Now I go to the gym in off hours. I go during the early afternoon when nobody's there. I'm not supposed to go during the peak times anymore. I don't go to bars with friends anymore because, especially this time of year, this winter's been a rough winter for illnesses. To go to a bar now with all the people hacking, coughing, sneezing, it's almost a horror story to me now. I know a few CFers with lungs not too much better than mine that still do it. Hey, more power to them. But the bars in my area I'm in a city area and they get pretty big and packed, and I can't do it. I'm like, CFers, here's a kind of a weird mental side effect of CF. CF people I know are total bloodhounds when it comes to a noise people make in public. You hear somebody clear their throat, cough, sneeze, or sniffle, and your head whips over to them Like, you will whip your head around so quick you'll bust a vertebra in your neck. You are listening, watching, and staring at them, trying to use every bit of your knowledge and experience to find out, now, did they just do that to clear the throat for some reason? Or are they sick? We are like bloodhounds to illness. Because we have to know. That's why I'm downstairs. My wife is sleeping upstairs because she's sick and I can't be near it. If I lay in the same bed with her, a couple feet away, without a mask, I can't sleep in a mask, so blah. You started cardio. It depends what type of cardio you're trying to do, dude. How are your joints? Some ellipticals, if they have a raising cross ramp, are actually better on your joints. There are versions of cross trainers where you barely pick your feet off the pedal. It kind of rotates in circular motion. Those are pretty good on your joints, as long as you don't run the level too high. Some ellipticals where they're flat, just a flat area, you're pushing back and forth on your knees can make them sore. Treadmills, if you know how to use a treadmill properly, a treadmill with a good padded deck is the best thing for your knees right now. Leveling. Because so ellipticals are so off and on. I worked at a gym for 13 years, so trust me, I got to see all the good and bad. Precor has ellipticals with a raisable cross ramp up front. If you raise it a little high, you're stepping up and you're not pushing that knee back and forth. You're going to want to find an elliptical with your knees are shot. You're going to want to find an elliptical that's not flat, slightly elevated front end, and use that. Do not do it in reverse with a bad knee. You can put a little pressure on it's nice to go backwards sometimes, but it's nice backwards to put more pressure on the knee. Also, do not raise the resistance too high. Some people make a mistake and get all frisky and raise the resistance way too high. Too high a resistance puts pressure on your kneecap. Pick a resistance where you're just getting your heart rate and breathing rate into the level for some of your age and height. Usually, some of the machines even have a chart on them showing if you're this age, here's where you should be for weight loss or heart training. Another good piece of cardio equipment for you if your knees are shot is the rowing machine if your back is not too bad. A rowing machine, you're using your knees, but you're not really putting tons of pressure. A lot of the pressure is going towards your lower hip area and up here. Give you a good workout between your shoulders up there. So look for a decent rowing machine. And once again, on the rowing machine, if they have a resistance setting, you don't have to crank it super high. You're looking to get your breathing rate just into that cardio training zone or the fat burning zone. Yeah, the bikes can be boring. That's why I have a TV in front of me. Most of our cardio equipment in my gym has TVs on them. When I use my treadmill here at home, I have my tablet on the treadmill and I'm watching something or YouTubing something or streaming from Netflix or answering people on Facebook or something because, yeah, it gets real boring. The good thing about stationary equipment is because you can do a set routine all the time and keep track of yourself, whether you're progressing or dropping. The set equipment can be better on your joints. Jogging outside is much harsher on your joints. A treadmill, as long as you're not holding onto the handles too much, trying to do too fast, too much incline or whatever, you can do a decent workout. Keep track, get yourself in that cardio zone without beating yourself up. And you can do it no matter what the weather is. Even the ellipticals, if it's the right elliptical, you'll get a good workout without beating yourself up. There you go. Happy days. Yes, there you go. Yes. See, that'd be a good show to watch. Also, I don't know if you had headphones on, dude. Put headphones on. Hearing the cardio equipment, the treadmill running or whatever, can make it longer. I don't want to hear anything outside of what I'm watching. Or sometimes I actually will be reading on the tablet, but my headphones are in because they're got that foam sound canceling stuff. I actually listen to myself breathe. I use my breathing sound to put me into a rhythm. Yeah, without headphones, it's not worth it, man. Without headphones, it's something to stare at, man. I'll tell you what, you want to walk out in traffic. So yeah, pick if they have a an elliptical, and it's got that front raisable cross ramp. A lot of Precors and some Life Fitness do. But some other brands, if some of a raisable cross ramp. Other than that, be very careful of them and keep them on a low setting. You use the lowest setting as possible and use speed more than resistance to get yourself into that fat burning zone or heart training zone, whichever one they want you to do. Treadmill, same way. You don't have to run on a treadmill. You can walk. You use incline on a treadmill because when you jog, you do come down much harder than when you walk. So walk on the treadmill and use incline to help make up for it, but do not hold on to the handles like this and hold yourself because you're not angled to the treadmill. You can rest your hands on there, but make sure you're not holding on. The rowing machine. There's no impact on a rowing machine. You do use your knees, but take a look at that. Also, good shoes. I will buy a $15 pair of cheap blue jeans. I'll buy a $3 t-shirt. I'll buy cheap clothing, but I will not buy cheap shoes. I buy good shoes. I've worn 3 pairs of these now. These Asics I wear all the time. These things are total badass. I've worn 3 pairs of these Asics. I take out the stock insoles that comes in them, and then I buy a pair of good insoles to put in them. So I buy good expensive shoes and put good expensive insoles in them. That is not where you want to stick in, especially if you got bad joints. So I don't care if you wear a pair of $2 nut hanging out cutoffs, but wear some good shoes. I'll save you a lot of trouble. Actually, you can. You can turn back time. Once you get into it, dude. Yes, you can. There are normal people my age. I know people my age that have a harder time getting up steps as I do, and I have 33% of my lungs left. They're horribly overweight, hugely out of shape. One of them smokes like a fiend. In fact, he just stopped 2 months ago. And he said he didn't know food tasted that good, actually. He didn't realize that. He was vaping for the last year, and that wasn't no better. And they found out that the vaping actually puts more of it into your system. So that's nice. But he stopped a couple months ago. But yeah, he's starting to get a little better. But I could go up steps better than him. He was about 80 pounds overweight and too much smoking and sitting. So you can turn back time. I have a friend that quit smoking when him and I were in college 20 plus years ago. He smoked clear up till then. He's 15 years older than me. He quit, and he knocked 110 pounds off himself, has kept almost all of it off, goes to the gym, and he changed his diet, not tons, just threw a little more salad and a little more water before eating in. So he's in better shape now than when he graduated high school, and he's in his 50s. So you can turn back time. Just don't give up. It's called a workout for a reason. Just because you have to work, don't mean you can get out. Yeah, the smoking is bad. Especially at our ages. And you're young, aren't you younger than me? Yeah, you're younger than I am. Pretty sure. Aren't you? I know Zeke is 33. Or is he 34 now? Shit. Lost track. Okay, see, yeah, you're younger than me. But yeah, that stuff takes a toll, especially when you get older. Hell, I got a cousin. He is 5 years younger than me. He's 39 or 40. He's had 2 heart attacks already. Because he eats junk food and smokes a lot, and the doctor said, that's it, you better stop or else. Well, guess what? We don't think he's going to last as long as he hasn't stopped. When you have 2 heart attacks by the time you're 40, that's it. It's time to stop. No, you do fine. You got your daughter to work for. You got a lot of friends and stuff. Just get with it. Stick with it. It does take work. It takes getting used to. Don't think you're going to go in there. You'll have good and bad days too. After doing this all these years, I'll have a day where every joint feels good, my stride is perfect, my breathing rhythm is dead on. I go in feeling so loose. I'll have a great workout. Then the next 2 days suck. So yeah, just pick it and pick something, stick with it and try. Well, try it and see you like it. Maybe you'll like the treadmill. Maybe you'll like the elliptical. Maybe you'll like the rowing machine. If you go to a gym, throw some weights in. You don't have to do heavy weights. Lightweight, high reps. You want to do lightweight and do 15 to 20 reps at a set. And just enough you start getting your breathing rate up near the end of that set. Do like 3 or 4 sets of that. That is also a slight cardio workout. And it will start trimming you, and you can even build a little muscle off lightweight and helps your joints. So throw that in with a little cardio if you're going to a gym. I do have a treadmill here at home, but I do like using one at the gym a little better. I think my treadmill's kind of evil. And somehow, even if you got headphones on and you're watching a tablet, it's about a gym environment and a very, very expensive treadmill that helps. But yeah, I'm telling you, man, death ain't all it's cracked up to be. I tried it once. I barely remember because I was very young. But I don't remember feeling or hearing anything good about it. This whole death thing is a big deal. As far as I know, life is the best thing going. That whole death thing, religious people can tell me, oh, you're fine, you go to heaven. Are you sure? Nobody goes and comes back. Well, I technically did, but I was too young and I don't remember if I saw a light or anything. I was 4. I think I was dead for 5 minutes. But I do still say I already died once. Do I have to do it again? A total gym this week, one in Norristown. Really? Do you guys have Anytime Fitness Corporation gyms over there? Anytime Fitness, I don't know if you know what it is. Anytime Fitness is a company. It's a chain of gyms, 24-hour gyms. They are actually in multiple countries. I know they're in Australia somewhere. Uh-oh. No, I didn't. I didn't unplug nothing. Stop jerking with me. That was interesting. Hopefully my sound didn't go away. Because my thing just... Oh, okay. I'm good. Sure, my sound already acted up. Yeah, Anytime Fitness is a big chain of gyms here. The one thing good about them I like is my membership at that gym that's like 5 blocks from my house is good at all the Anytime Fitness in the world. We have like 3 of them in this area, or 3 or 4 in this area. I can go to any of them. I've gone to some in Nebraska. I've gone to plenty of them around the country as I've traveled. And I know there's some in Europe. I don't know how many in Europe. I know there's some in Australia. But they are a worldwide gym. But it is nice to have that one membership good anywhere I go. So if I can get a hotel really close to one, which I can also look on their gym finder and try to match a hotel close, I'd be a couple blocks away and I can go to the gym. That's how imperative it is as I go. But for a CF person, and I do have a decently high level of digestive problem also. I see we've got a decently 7-ish high, or the lung and the digestive part. But I also know how to exercise and nourish myself to keep my weight up. I'm on an unlimited diet. A lot of CF people have huge weight issues. They can't keep their weight up. They're very thin. My weight, I'm 165 pounds at 5'7", so I'm doing pretty good. If you go by BMI, I'm overweight, but BMI sucks. But I don't know if you had anything else, any other questions, man, but I hope I answered you. If you have any questions about working out, ask me. I've been doing this for 7 days a week for over 30 years. I worked at a gym. I've worked with trainers. I've worked with physical therapists. I got a good idea of what it is, and if it's something I don't know, I can suggest where you go look. But pick something. Working out isn't always fun, but pick the thing you hate the least. Let's try that. the better you get it. Oh, the Total Gym. Yes. In one of my hospital explorers, I took a picture of the Total Gym. I actually made a joke about Chuck Norris is going to be pissed. I've heard some people say they like those, some that say they hate them. My dad has a Bowflex that he never uses. I'm about to steal his Bowflex. I would love to have a Bowflex here at home. Those are pricey. But he has the money. Now, are you just, oh, okay, 35 minutes a day? Are you doing just cardio or cardio and weights? If you're doing just cardio, 35 minutes a day is fine. That's as long as at least 20, 25 minutes of that, you're getting your heart rate in that zone they want you in, whether it's a fat burning zone or the cardio training zone. And you can look it up online for your age too. Oh, 35 is perfect for cardio, dude. No, that's perfect. Yeah, 35 is great. I do 30 to 45 minutes on the treadmill. That's what I do. 30, 35-minute workout, yeah, you'll be fine. You don't want to overdo it, especially to start off. Yeah, that'd be perfect. Especially if you get that in that zone where they're going to want you for at least a good part of the time. You're going to want to probably, the best way to do a cardio workout is do a 5-minute warm-up, which I don't do. I just start and go. Do a 5-minute warm-up and a 5-minute slow down. A cool down. The other 25 in between there, you want to be working it. You don't have to be killing yourself the whole time, but you want to be working out pretty up there. You at least get close to that. If they want you to do heart training, cardio training, look where the cardio level is and get yourself in that. Your doctor should be able to tell you a level he should want your heart rate at. And you're going to want to keep your heart rate in that zone. If you're doing 35 minutes, at least 25 of that, your heart rate should be at least be close to it. And a solid 15 of that, you should be in that zone. 15 at one time. So yeah, 5-minute warm up, 5-minute cool down, which I don't do the cool downs all the time either, so don't feel bad if you don't want to do it. Most time I just go and start off at a decent pace and kick it up. And the last 5 minutes is a real bastard for me. Then I just get off and I'm done. Sometimes when I do my longer 40, 45-minute workouts, I do a cool down at 3.4 mile per hour and 2.0 incline. So yeah, sometimes I do a cool down, but not on a 30-minute workout. I don't. Anything above 30, I do a little cool down. But yes, especially if you're new to this cardio stuff, I've been doing it. My body, as crappy as it is conditioned to work out. So if you're new, especially 5-minute warm up, 5-minute cool down. And after that 5-minute warm up, you want to ramp it up a little slowly, fine. But you want 15 solid minutes in there at a heart rate your doctor's going to tell you, at least 15. He may tell you he wants your heart in that zone at 20 or 25 or 30 minutes. So a good one to ask is, you need to just call your doctor and go, hey, what's a recommended heart level you want my level at to really be doing what you need me to do? Any good doctor can tell you. Or you can, like I said, online, Google, what's my cardio heart rate training level or cardio training level for my heart rate at 40 years old. Take that number and don't expect to hit it right away because you got about a month of working up to that. Those online or even on the equipment rates they give you is for somebody that's in some type of shape. I'm not saying you're out of shape. I'm just saying for somebody who's been doing it. It usually doesn't talk about the average Joe who's never worked out a day in his life hopping on the treadmill. Oh, I got to get my heart rate there. No. So yeah, your doctor will have you should be able to ask him. He'll probably give you a number that, okay, put your heart rate here and don't go above here. If you can feel your pulse in your ear hairs, you may have gone too far. Stuff like that. Well, it says there's 2 people watching. I know you're watching. I don't know. Is there anybody else there that's watching who wants to ask anything? Or comment? It says 2. I don't think it counts me as watching myself, because when I first started it said 0, so. Well, whoever you are, thanks for throwing an eyeball at it. Yes, that's something you're going to notice, dude. When you really get into working out, you get this thing called an endorphin high from working out. You can go work out and feel like this absolutely sucks ass while you're doing it, but when you're done, within 5 minutes or sometimes up to 45 minutes later, suddenly you'll start feeling this really cool, happy high going. And sometimes you'll get, it's like a drug, you can get addicted to that high of working out, which is good. If you can get addicted to that, means that's a good addiction because you want to do it to get that great feeling. There's also just being damned happy that you're done with it. There's been a few days I've walked away from the treadmill, turned around and gave that thing a bird. I was not happy with the treadmill, how it treated me that day. Yeah, keep track. I don't know, hopefully their treadmill's got the heart rate monitors on them. You can pulse grip, grab the things and watch them. And don't hold on to those the whole time. Only hold on to those when you want to check your heart rate. Sometimes make a mistake and hold on to those and it throws off your gait, can make your back sore, your knees hurt, stuff like that. But yeah, it's good that you're doing it. It's a good payoff, yeah. There's got to be some type of payoff, right? Live longer and okay, and I feel frisky. Oh, orange juice is keeping my throat going. But hey, I'm glad I could help you out. If you need anything else, dude, just PM me. You know how to get a hold of me in every dang way. But I'm going to get off here. It is 1:30 in the morning, and I got to get up early. I have to have my dog at the vet by 9 a.m. because he's got some joint issues. He started walking a little funny, and he's due for his booster shots anyway. He's due for rabies and all that stuff. So I got to get out of here 8:30. After I do my treatments for 2 hours, I got to be up at least 5 a.m., 6, somewhere in there. But it was good talking to you. Thanks for coming by. And for any other CFers, like I said, what treatments, drugs, what side effects you get from all these? And, you know, what one is your biggest problem? And what thing is the biggest thing that can help you, like exercise and stuff like that? Other than that, I'm going to get out of here. And this is Kylie from Cystic Fibrosis Purple People Eater. See, I even got the dang air to say it. And talk to you later. And thanks for throwing an eyeball at this. And hopefully you learned something or went, wow, this guy's wacko. See you later.